Not me, but my spouse. He was dealing with a severe earache and visited a nearby physician. The doctor's wife served as his nurse and, with complete seriousness, claimed the ear discomfort stemmed from malevolent spirits. It didn't take long for him to leave and seek another physician. Some folks are wild. Arrogant and patronizing. I'm a woman in my 20s who saw a urologist, and he asked for a list of my medications. When I mentioned testosterone cream, prescribed after tests showed low libido linked to low levels, he was adamant I meant estrogen cream. I clarified it was testosterone, but he instructed me to go home, fetch the bottle, and read the label to him over the phone. This physician treated me like a kid, asking me to waste time on this task because he didn't know women's bodies produce small amounts of testosterone, which is essential. I'd been feeling unwell with a persistent cough. I consulted multiple specialists, including an internist, an oncologist, a hematologist, and an ENT to pinpoint the cause. After examining me, the ENT stated that coughing irritates the throat and suggested I simply stop coughing to resolve the issue. Apparently, that insight required medical training. Later, I learned I had non-Hodgkin's lymphoma, with a tumor in my chest. It took 11 months to diagnose, but chemotherapy eventually eradicated the cancer and the cough disappeared. We were organizing my son's first international trip. He visited the doctor for a flu shot, a tetanus booster, and advice on preventing and managing jet lag while staying healthy abroad. My son was 10 and my daughter was 18, still in high school. My daughter went first, receiving her flu shot and a prescription to ease her nerves during the flight. Extreme anxiety and fear of flying don't mix well for a 17-hour journey in a metal tube over the ocean. The doctor handled her well, treating her maturely. Great. Then it was my son's turn. At the time, Ebola was the terrifying disease everyone feared, and my son expressed his worry about catching it. The doctor reassured him that his risk of getting Ebola was nearly zero, but emphasized the need for a tetanus booster. Then he had the audacity to tell my son he didn't really need a flu shot because nobody actually dies from the flu. Absolutely not. My great-grandmother passed away from the flu. My son, the same kid in that exam room, nearly died from RSV as a baby. Yes, I know RSV and influenza aren't the same, but RSV damaged his lungs as an infant, making him highly susceptible to complications from any respiratory illness. That boy was getting his flu shot, and I wasn't thrilled about this doctor telling him it wasn't necessary. As I began my rant about how RSV nearly took his life and we wouldn't take foolish risks, the doctor quickly backtracked. "Oh, absolutely. We'll ensure he gets his flu shot today." You bet he did. I was throwing up blood and experiencing intense abdominal pain. I went to the emergency room at one of New York University's hospitals in New York City. The young doctor, possibly a resident, maybe not, performed an ultrasound despite saying he'd order a CT scan. I wasn't given a blood test or any pain relief. I stayed there for over 5 hours and was discharged with medication he claimed would stop the vomiting. It didn't, and I continued to vomit. 2 days later, the pain was so severe I couldn't sit upright. An ambulance picked me up, and the EMS advised me to insist on a blood test and CT scan. My appendix had burst, and it was nearly too late, as the infection had spread to my other organs.